In this video I'm going to talk about eye and ear problems. So a few age-related changes that can happen to the eyes are presbyopia, which is a loss of accommodation or recession of near point. So it's a loss of lens elasticity that occurs usually between the ages 40-45. It causes blurred vision. Other age-related changes could be small pupils and therefore poor adaptation to the darkness, flattened cornea, which causes astigmatism and blurred vision, a lighter iris, yellowing of the sclera. This doesn't mean they're jaundice, it's just an age-related change. Or arcus senilis, which is an opaque white ring, which is made of fat granules about the periphery of the cornea. Myopia is nearsightedness, and this is an eye-focusing disorder, and it's an increase of the eye's axial length. It's caused by an abnormal shape of the cornea or lens. Risk factors for myopia could be age, disease like diabetes, or just inheritance. And the sign and symptom is blurry, distant vision, so they have a hard time seeing things in the distance. And then the treatment for myopia or nearsightedness is glasses. With these patients, make sure to promote safety, especially if they're having a difficult time seeing. They're more prone to trip or injure themselves. Hyperopia is farsightedness. So this is the opposite of nearsightedness, and they struggle to see things that are near to them, struggle to see things that are up close. A detached retina is a condition which is a separation of the retinal pigment epithelium from the sensory layer. A detached retina can lead to blindness if it's not repaired. A risk factor for detached retina is myopia or nearsightedness. So signs and symptoms of a detached retina, it's usually painless, but they may see flashing lights, and they may feel like there's a curtain or a shadow in their vision field, and they may also see floating spots. Surgical management for a detached retina could include scleral buckling, which is a band used to indent the scleral wall and brings the two layers back together until they adhere together. Other surgeries that can be done for a detached retina could be laser photocoagulation or pneumatic retinopexy. Okay, moving on to macular degeneration. Age-related macular degeneration is a leading cause of vision loss in patients over 60 years old. Risks are that it's hereditary, smoking, injury, inflammation, and poor nutrition. There's two different types. There's dry macular degeneration or wet macular degeneration. Signs and symptoms of macular degeneration could include loss of the central vision. Straight lines may appear to be crooked or wavy, and they may have difficulty with fine visual experiences like sewing or reading. Therapeutic management could be photodynamic therapy, and that's usually used for wet macular degeneration. Interventions for these patients include safety and fall prevention, encouraging regular eye evaluation, and assisting the patient in obtaining aids to enhance their vision. Papilledema is impaired ocular movements, facial sensory loss, loss of corneal reflex, all caused by increased intracranial pressure due to brain tumors, strokes, intracerebral hemorrhages, or bacterial meningitis could all cause it. So the treatment would be to decrease the intracranial pressure, but do not perform a lumbar puncture because the sudden decrease of the intracranial pressure can cause herniation. Okay, moving on to ear problems. So otitis media is an infection of the middle ear, and this is more common in infants and children because their eustachian tube is shorter. So signs and symptoms of otitis media are ear pain, fever, that's really about it. For signs and symptoms, just the ear pain and the fever. Medications, they could be taking an antipyretic to decrease their fever, antibiotics to kill the bacteria causing the infection, and analgesics to help with the ear pain. Okay. Menieres disease is an abnormal inner ear fluid balance due to malabsorption in the endolymphatic sac or blockage of endolymphatic duct that leads to increased pressure or rupture of the inner ears. So this usually will affect their balance mostly. So these patients, some signs and symptoms you may see with Menieres disease is headache, vertigo or dizziness, nausea, or tinnitus, which is ringing in the ears. Medications that can be given are antihistamines or otics, which are otics, are used and administered to treat conditions of the ear. So examples of that could be carbamide peroxide or boric acid solution. Interventions for patients with Menieres disease would be to promote safety, to provide teaching about the condition, and then diet changes. People need to eat plants and whole grains, limiting stimulants like caffeine, and eliminating sodium or extra sodium and sugar from their diets.